If you are living with urinary incontinence, it's normal to have many questions and not know where to turn to for answers. The best place to start is by consulting with your doctor. They can provide insight on the condition itself, treatments available, and even lifestyle changes you can make in order to continue pursuing passions while managing your symptoms. While the non-athlete fitness team has also put together some information for you if you find yourself dealing with an overactive bladder and bladder leaks, make sure to always check with your physician for the best course of action. So what is urinary incontinence? Urinary incontinence happens as a result of weakened connection between the bladder's muscles and nerves. This can cause embarrassing accidents when you laugh, sneeze, or cough. Not to mention an urgent need to use the restroom as quickly as possible. Are there different kinds of urinary incontinence? Yes, there are 5 basic types. Number 1. Stress incontinence. Urinary stress incontinence can lead to involuntary leakage of urine whenever you experience any physical pressure, such as laughing or sneezing, lifting heavy objects, or engaging in exercise. Number 2. Urge incontinence. Urge incontinence, also known as overactive bladder, is when you unexpectedly and suddenly feel the urge to urinate and end up leaking urine. Do you frequently need to go 8 or more times a day? And how about multiple times at night? Or do certain sounds like running water make you want to use the restroom even if your bladder isn't full yet? If any of these describe your situation, then it's likely that an overactive bladder might be your issue. Number 3. Mixed incontinence. Women often experience mixed incontinence, a condition which presents with both stress and urge incontinence concurrently. Number 4. Overflow incontinence. Overflow incontinence, a condition more regularly seen with men, is when you can't completely empty your bladder before it becomes full. This may cause involuntary leakage of urine afterwards. Number 5. Functional incontinence. Functional incontinence is a type of urinary incontinence that occurs when an individual's medical condition, such as arthritis, prevents them from reaching the restroom before it's too late. What causes urinary incontinence? Some causes of urinary incontinence include urinary tract infections. This infection can cause intense bladder discomfort and an almost instant need to urinate, sometimes resulting in involuntary loss of control. Pregnancy and childbirth. The strain from the weight of a baby and labor can stretch muscles, ligaments, and nerves in the pelvis to an extent that leads to incontinence. Menopause. During menopause, when estrogen levels decline, stress incontinence and overactive bladder tend to become more common. Estrogen is the key ingredient in maintaining healthy bladder muscles, pelvic muscles, and urethra. Smoking. Although the exact cause remains unknown, medical research has revealed that smokers are far more likely to experience incontinence than non-smokers. Being overweight. Having extra weight can result in unwanted pressure on your bladder, making it difficult to contain urine. Medical conditions. Individuals with conditions such as diabetes, multiple sclerosis, and Parkinson's disease may experience nerve or muscle damage. Anxiety can also be a contributing factor in the onset of incontinence for some people. Medications. If you suffer from incontinence, certain medications such as diuretics, sedatives, sleeping pills, and antidepressants may aggravate your symptoms. Speak to your doctor to find out whether any of the drugs you're taking could be causing your incontinence or making it worse. Hysterectomy. When a surgery is performed to remove the uterus, it can cause damage to the muscles and ligaments that support the bladder. What can you do to stop bladder leaks? Drink as much water as you can. Strive for 6 to 8 glasses of healthy fluid every day, unless your doctor tells you differently. Though many people with urinary incontinence don't drink much in an effort to reduce symptoms, this can have a reverse effect by decreasing bladder capacity and leading to constipation or worsening existing issues. Make sure you know which beverages are best for your health. Quit smoking. Smoking can be a major factor in bladder control issues, as coughing leads to strain on your pelvic floor muscles. Consequently, if you are a smoker, you put yourself at risk of developing urinary incontinence. Do the right exercises. Vigorous exercises and sit-ups can cause strain on your pelvic floor muscles, increasing episodes of leakage. To combat this issue, modify high-impact activities such as jogging or aerobics with strengthening exercises like Pilates. Not only does Pilates condition your core muscles for improved fitness, but it also helps to reduce symptoms associated with stress incontinence. Lose excess weight. Struggling with being overweight can lead to weakened pelvic floor muscles and even incontinence due to the pressure of fatty tissue on your bladder. Fortunately, if you shed any extra pounds, it is likely that many of these symptoms could diminish or completely disappear. Don't force a constipation. Straining to poo weakens the muscles of your pelvic floor and worsens urinary incontinence. Never brush off the urge to go, as there are solutions. Seeking dietary advice from a nutritionist or physiotherapist can help with constipation. This may involve increasing fiber intake and exercising more consistently. Moreover, examining the technique you use when sitting on the toilet could make all the difference. Cut down on coffee and tea. Consuming caffeine can agitate your bladder and make incontinence worse, so it's best to reduce or entirely avoid coffee. Sodas, teas, green tea, energy drinks and hot chocolate all contain caffeine too. Replace these with water or decaf beverages as well as herbal or fruit teas. By eliminating these items from your diet altogether, you will be able to improve your bladder health in no time. Avoid lifting. Hefty loads can be especially tricky on your pelvic floor muscles, so if you are able to, try and stay away from lifting. If a lift is necessary though, activate the muscles of your pelvic floor prior and all through the movement. Cut down on alcohol. Alcohol is known to cause frequent urination, and reducing your alcohol intake can often improve incontinence symptoms. Do daily pelvic floor exercises. Performing pelvic floor exercises correctly can be highly effective at reducing leakage. Make sure to carry out the moves properly and, with a bit of patience and dedication, you may see results in as little as 3 months' time. So there you have it. Talking about urinary incontinence with anyone, especially physicians, can seem uncomfortable. However, it's a treatable condition and seeking your doctor's counsel is vital to taking the first step towards recovery. Furthermore, talking to individuals who have gone through similar experiences could be beneficial as well. You may find out which treatments and lifestyle changes are effective from those who are dealing with the same issue. Want to learn more? Make sure to check out some of our other videos on women's health in the channel. Until next time.